Okay, I promise this video will be a lot shorter. Antifungal and antiviral agents, Chapter 8. So antibiotics and anti-infectives are effective against a certain spectrum of organisms: bacteria, protozoa, rickettsia, trichomonads, amoebas, and spirochetes. They're not effective against either fungal or viral infections. Nystatin. This is something you'll become familiar with in the dental offices. The brand name's mycostatin or Nilstat. Imadazoles. There's clotrimazole or Mycilex. Ketoconazole, and that's Nizarole, and other imidazoles, which is fluconazole, or diflucan. Other antifungal agents, which we won't really get into: amphotericin and griseofulvin. The mechanism of action: it binds to sterols in the fungal cell membranes. It's not absorbed from mucous membranes or intact skin. It's poorly absorbed from the GI tract, and it's excreted unchanged in the feces. It's both fungicidal and fungistatic. So, adverse reactions to nystatin: they're minor and infrequent. Applied topically or taken orally, little if any absorption occurs. Higher doses result in nausea, vomiting, and diarrhea. Rarely hypersensitivity reactions have been reported. So nystatin is used for both treatment and prevention of oral candidiasis in susceptible cases. C. albicans is a frequent inhabitant of the oral cavity. However, only under unusual conditions does it produce disease. Often affected patients are immunocompromised. Why is the sucrose contents of nystatin of importance? It's because as a rinse, it's cariogenic. For patients with diabetes, the sugar content must be taken into consideration when planning meals and insulin use. The lozenge takes 15 minutes to dissolve in the mouth, so it is also cariogenic. Imidazoles, the ones that are useful in dentistry: again, it's clotrimazole, ketoconazole, and miconazole. And then there's fluconazole. But these three, the first three, are used in dentistry. The other one, that's usually a pill form, and it's an oral antifungal agent indicated for treatment of oropharyngeal and esophageal candidiasis and serious systemic candidial infections. Clotrimazole is a synthetic antifungal agent available as a slow-dissolving, sugar-containing lozenge for oral use. Patients with xerostomia may have difficulty dissolving this product. So each lozenge contains 0.9 grams of glucose. And the fact that the lozenges take 15 to 30 minutes to dissolve and the sugar is in contact with the teeth for long periods of time make these lozenges cariogenic. It's available as an over-the-counter cream for topical use to the skin or vaginal canal. It can also be applied to the contact side of the denture to kill the microbes causing the stomatitis on the tissues. Clotrimizole's mechanism of action involves alteration of cell membranes, permeability, and it binds with the phospholipids in the cell membrane of the fungus. So as a result of the alteration in permeability, the cell membrane loses its function and the cellular constituents are lost. Ketoconazole: it alters cellular membranes and interferes with intracellular enzymes, which renders the membrane permeable. Ketoconazole requires an acidic environment for dissolution and absorption. Theoretically, agents that alter the amount of stomach acids, such as the anticholinergic agents and antacids, reduce the absorption of ketoconazole. Ketoconazole and the other imidazoles interact with the anticoagulant warfarin, increasing the warfarin blood levels and increasing the risk of bleeding. Ketoconazole is indicated in the treatment and management of mucocutaneous and oropharyngeal candidiasis, oral thrush. You need to know that, highlight that. The most frequent adverse reactions reported include nausea and vomiting. However, this can be minimized by taking the agent with food. The most serious adverse reaction is hepatotoxicity. It's usually reversible on discontinuation of the drug, but it has been fatal. Because of its adverse reaction profile, ketoconazole should be used only after topical antifungal agents have been ineffective. Fluconazole or diflucan is an oral triazole antifungal agent. It's indicated for treatment of oropharyngeal and esophageal candidiasis and serious systemic candidal infections. That's what we said. So the search for drugs useful in treatment of viral infections has posed the greatest problem in all infectious organisms. This is because viruses are obligate intracellular organisms that require cooperation from their host cells, which means to kill the virus means you have to often kill the host cell. So some antiviral agents for the herpes simplex, there's acyclovir, docosanol, penciclovir, and famciclovir. For AIDS, we have nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors, protease inhibitors, combinations, and then there's other antiviral agents. So some adverse effects have been reported when using acyclovir. When placed topically, people have reported burning, stinging, or mild pain. Headaches have been reported. CNS, it has affected the CNS, which may cause dizziness, vertigo. Then there's GI effects that have been reported. Anorexia, funny taste or dysgeusia, acne, accelerated hair loss, menstrual abnormalities, arthralgia, fever, sore throat, lymphadenopathy, thrombophlebitis, edema, muscle cramps, leg pain, and palpitations. All of that has been reported when using acyclovir. So uses, the indications for topical acyclovir include limited non-life-threatening initial and recurrent mucocutaneous herpes simplex virus 1 and 2 in immunocompromised persons. Topical acyclovir has not been effective in the treatment of infections in non-immunocompromised patients. So what you need to know, it does not prevent the transmission of infection. It does not prevent reoccurrence. Although available literature does not support the use of topical acyclovir for management of herpes labialis in dentistry, it is used extensively. Oral acyclovir also has unimpressive results. Docosanol, Abreva, is available topically and without a prescription. You need to know it has been shown to decrease healing time by about half a day in a patient with recurrent oral labial herpes when started with 12 hours of the appearance of the prodromal symptoms. Penciclovir or denavir is available topically as well. It has been shown to reduce both the duration of the lesion and the pain of the lesion on the lips and face associated with both primary and recurrent herpes. Famciclovir and valacyclovir are prodrugs that are converted to penciclovir and acyclovir as they pass through the intestinal wall. They are indicated in the treatment of recurrent episodes of genital herpes and acute localized varicella-zoster infections. So, acquired immunodeficiency syndrome. AIDS is a chronic disease produced by infection with a retrovirus human immunodeficiency virus. Antiretroviral viral agents are used in combinations called cocktails to manage AIDS. Opportunistic infections often occur in patients with AIDS, so they may be taking various anti-infective agents to prevent diseases such as tuberculosis, pneumonia, herpes infections, and candidiasis. Nucleoside reverse transcriptase inhibitors are the first class of drugs developed to treat HIV. Zidovudine, or AZT, retrovir, was the first in this group and is converted into zidovudine triphosphate and then incorporated into DNA polymerase so that the synthesis of viral DNA is terminated. So AZT is well absorbed orally, metabolized by the liver, and excreted by the kidneys with a half-life of about an hour. So AZT inhibits HIV synthesis and reduces the morbidity and mortality of AIDS and AIDS-related complex. Opportunistic infections are reduced in both number and frequency. So toxicity related to bone marrow depression, there's CNS effects such as headache, agitation, and insomnia. Oral manifestations are taste perversions, edema of the tongue, bleeding gums, and mouth ulcers. Acetaminophen, indomethacin, and aspirin can inhibit AZT's metabolism and potentiate the toxicity of both drugs. Nevirapine, specific for HIV-1. These agents inhibit the same enzymes as the nucleoside analogs but don't require bioactivation. Adverse reactions include CNS effects, rashes, GI effects, elevated liver function tests. Protease inhibitors such as saquinavir interferes with the action of HIV-infected cells. Adverse reactions: rash, hyperglycemia, paresthesia, GI effects, and buccal mucosal ulcerations. We have the fusion or the entry inhibitors. This blocks the progression from HIV infection to AIDS. In Fufurtide, skin itchiness and swelling and pain have been reported. Maraviroc, cough, fever, dizziness, nausea, and headache. Integrase inhibitors. Integrase inhibitors are designed to block or inhibit the action of integrase, which is a viral enzyme that inserts the viral genome into the DNA of the host cell. Okay, so some drugs are combined to produce an improved effect in the management of HIV and AIDS. We're talking about, on this slide, highly active antiretroviral therapy, which is HAART. This is a combination of several different classes of antiretroviral drugs which slow the rate in which the HIV replicate in the body. The combination of drugs called cocktails is constantly changing, and its rapid changes in the drug therapy make it impossible to predict what specific agents will be used in a few years. It is important to obtain information about the newest drugs before planning dental treatment. Normally, patients with HIV will be taking 3 drugs: a nucleoside, a non-nucleoside reverse transcriptase inhibitor, and a protease inhibitor. So here is a list of just examples of drugs used to treat HIV. You will get to them in one of the YouTube videos that I'm having you watch for memorization of the top 200 drugs, and you'll recognize a few of them that I want you to focus on. But for now, you're not being tested on any of these, so I'm not going to repeat them for you. You can just look at them and refer to the table in the book if you want to know more about them. Chronic hepatitis. Chronic hepatitis is what it is when it lasts longer than 6 months. It's inflammation of the liver. Presents with no symptoms or very few symptoms, such as jaundice, anorexia, or just malaise, which is just feeling bad. What you need to know: hepatitis B and C are the most common causes of chronic hepatitis, accounting for almost 2/3 of all hepatitis cases. Those persons with hepatitis C are most at risk for developing chronic hepatitis. It is considered to be chronic when it lasts more than 6 months. And of course, it's the inflammation of the liver. Usually no symptoms, however, it often leads to jaundice, anorexia, and malaise. So nucleotide analogs are available for the treatment of chronic hepatitis B. You can review this medication list. Although the optimal duration of therapy is unknown, many patients are treated for at least 5 years and some indefinitely. Sudden discontinuation of these drugs can lead to a rapid increase in hepatitis B virus DNA levels, which result in a severe flare-up of the disease that can be fatal. And although well tolerated, reported common adverse effects include headache, nausea, vomiting, and diarrhea. Interferons are a large group of endogenous proteins that have antiviral, cytotoxic, and immunomodulating action. The FDA has approved interferon alpha for the treatments of chronic hepatitis B and C. Some adverse reactions for interferons: myalgias, fatigue, headache, arthralgia, CNS effects, fatigue, fever, headache, depression, and chills, GI effects, nausea, vomiting, diarrhea, rashes, taste changes, reactivation of herpes, and excessive salivation. Protease inhibitors. Here's your list. So the first two, boceprevir and tenofovir, they were approved by the FDA for use in combination with peginterferon and ribavirin for the treatment of chronic hepatitis C, Geno 1 type infection. So for a certain type of infection with hepatitis C. Some adverse effects include fatigue, anemia, nausea, and rash. Some dental hygiene considerations. You need to be able to educate your patient. So the proper application of the antiviral, antifungal drugs should be reviewed with the patient. The patient should know how to take or apply the drug and understand the importance of completing drug therapy. If the patient is on an oral dose form of antifungal drugs, he or she should be encouraged to brush their teeth, rinse, and swallow after using such antifungal drugs such as nystatin and clotrimazole. So what do you think the reason would be to have your patient brush their teeth after using it? It's because both products contain sugar. So the dental hygienist should be aware of drug interactions and the clinical implications of patients taking drugs to treat hepatitis or HIV. So you can look these terms over. You should know them. You'll see them often. As you know, in pain, we know what pain is, but there is a definition in your pharmacology book that you want to know. Reyes syndrome, of course, you should know that by now. And just look these over, make sure you know them. Oh, look, I even gave you page numbers. And this is not on your PowerPoint, so really pay attention here, because you are going to have on the test some true falses that are in, you need to know this material right here. Look at that, handy page numbers and everything. So those of you who did your due diligence and watched these films that I've painstakingly put together for you, you guys are going to rock the test. Anyways, good luck.